Hey guys, Don here. Welcome to Podiatry Practice Mastery. I'm doing another kind of question email that a doc had. He's once again in the orthopedic group, and so we were talking about shockwave and ultrasound. So I have the ultrasound that I have is one. It's like in a stand, and then I move it from room to room. If you have a butterfly, which is a handheld device, there is a little stand that you could buy and move from room to room, and then you document, and that should upload into your EMR. So in terms of increasing efficiency, I have a little button in each of my treatment rooms, and I hit the button, and it like puts a dinger off so my staff know I need something. So that's the first thing. And so if I need it, I'll ding them, and they'll bring it in, okay? Or ultrasound or whatever else I need. Second thing is I never do ultrasound my first visit. It's usually I start with some things. I get x-rays, so those are automatically done. And at the follow-up, I will do the ultrasound, and I put it in my follow-up note, like 2 or 3 week follow-up. And then with ultrasound. So they'll bring it in. It's already prepped. All their information is already in there. And then I just kind of document that. So that's how I do ultrasound. It's a great diagnostic tool. Less MRIs are needed because of that. So those are my tips. The other tip is I did a recent article in Podiatry Management that's in there on ultrasound to work with flow, okay? The other thing is for templates, I document it within my EMR, and it goes into my PAC system. So I have these templates for ultrasound templates as well that this you can click and go. That's how my scribe does it for me. The next thing you asked me about was integrating shockwave and amnio into the practice. So PRP is good revenue generator, I agree, but shockwave I use all day long. So if there is an effusion in the tendon, if there's an area like even a fracture, things like that, I do it all day long. So all Achilles tendonitis, plantar fasciitis, peroneal tendonitis, posterior tibial tendonitis or dysfunction. If there's pain, they're tending to get that. They're tending to get a compression sleeve. If there's a lot of swelling, they might get like a Uniboot once to calm things down. If it's a really bad ankle sprain as well, I use it. But I'll do ultrasound, then I'll do shockwave. The way I keep it simple is if it's less than 6 months, I'll do 3 sessions. If it's over 6 months, I'll do 6 sessions. Usually after shockwave, I'll do 6 weeks of physical therapy. So I charge $250 per session, so it's $750 for the 3 sessions and double that for the 6 sessions. The amnio I use ViaFlow, and I reconstitute it. But you could use PRP, same thing. I just don't like to draw blood. I can go over more detail if you want with that, and then I charge $1,500 for that. It's an expensive product, but it's a good product by right. And then the shockwave, I use Curamedics, so I have a EPAT, radial, and a focus machine. I think it's the best machine out there. Once again, I charge, if I'm doing combo, which is both, I will do $250 per session. And if you have PAs, because we're talking about that, you could even consider having PAs do it for $200 or $175. If you get the return on it, it's probably good to do that. So anyway, that's kind of how I do it. And then based on the ultrasound is what I decide if they need amnio, right? If there's a tear in the tendon and they're wanting to be braced or something else like that, I'll do that versus a cortisone injection. So I'll do amnio with the shockwave. And then in terms of physical therapy, the first shockwave appointment is when I prescribe PT, because it takes them usually a couple weeks to get in. So I'll do the 3 shockwaves. Now at the last shockwave, I have a special handout I give them. I'll send it to you. And that handout is kind of like the way I can do an office visit for the last shockwave visit. It kind of goes a little bit more in detail. I do a level 3 office visit at that time. Okay, so those are kind of this is both a podcast, but also information for this doctor that asked this question. Those are kind of my protocols for shockwave and amnio and stuff like that. If you're interested in like this stuff, coaching, for anyone listening, go to podiatrypracticemastery.com. There's a coaching section on there, and we can kind of meet up, and I'll probably take whatever your question is and make a new podcast for it. But if you don't mind that, it might help you out. Okay, thanks.